Good afternoon. Thank you for being here with us this afternoon, and look forward to taking your questions once everyone has an opportunity to give an update. We are in the middle of a fight for our state. It is taking a tremendous cost. It is asking all of us to push ourselves beyond what is comfortable, what is fair, or sustainable for much longer. Please stay strong. Stay in the fight. We can see the finish line, but the push to the end requires all of us to sprint. We are at or near our peak in Mississippi. This is the most painful time. This is the hardest time. It is the beginning of a turning point, but we have not gotten past our peak pain yet. I pray every day for an end to this COVID-19 crisis, and we are all acting together to protect our people. We have been through other trials and overcome. We will come through this also. I know that what is being asked of you is not easy. It's not even close to being easy. We also know that the collective work of our people is having an impact. The damage could be far, far worse. Our projected pain is coming down dramatically. It hurts, but it is working. You are saving your neighbor's life. When we avoid death, we only see the cost of the sacrifice. But please know that you are saving lives every day that you stay in the fight and every day that you stay sharp. We cannot eliminate the burden that comes with all of this. Our enemy is doing great damage, not only to those who catch the disease, but to those who have lost the ability to provide for their families. We can't yet fully stop the mental, financial, physical cost to you and your family any more than we can fully stop this virus. We can help lighten the load. Today, I want to share two new programs that we hope will help. The Mississippi Home Corporation has just authorized our hardest hit funds to provide short-term help with the mortgage for Mississippians who lost employment or significant income due to COVID-19. If you have lost the ability to earn during this crisis through no fault of your own, and you are at risk of losing your home, we can provide temporary help. It will not take over your home payments indefinitely. It will give you time to get your head above water, to find work, and to become self-reliant again. It may provide a one-time payment to make your mortgage current. It may also pay your mortgage for a time while you try to find work. I saw firsthand the homes that were lost to the tornadoes this weekend. It breaks my heart. There are more who are at risk of losing their home to our nation's economic crisis. We can't stop the wind from blowing, but we can try to stop more from losing their homes. You can go to mshomesaver.com to get more details and to apply. At this time, I'd like to turn this over to Scott Spivey from Mississippi Home Corporation, who is administering the program. Scott?
Thank you, Governor. Yes, so this is a program that's been in existence since the financial crisis in 08 and 09. These were TARP dollars that were repaid to the Treasury and authorized to provide mortgage assistance in 18 states plus the District of Columbia. They will expire next year. We had set aside some for blight elimination, and in coordination with Governor Reeves' office, are going to take this opportunity to move about $10 million that's remaining in the program for blight elimination back over and reopen the mortgage assistance pipeline. Homeowners can apply online, like the governor said, at mshomesaver.com. They'll be referred to a counseling agency that's in their area. We're working with a network of housing counselors to gather all the documents and submit them to the Mississippi Home Corporation for underwriting. This program will provide up to 6 months of mortgage assistance. So it is temporary, but it's important to note, and I think the governor's done a great job in these press conferences of explaining this, but forbearance is not forgiveness, and it's not forever. If people are putting their mortgages in forbearance, that debt still exists. and that's one of the reasons this is going to be an important program, so that they don't have to go into loss mitigation and they don't have to come up with a number of mortgage payments when forbearance is finally over.
Thank you, Scott. And Scott will be available a little later for questions on this particular program. At this time, we are also working to address one of the most taxing issues. Our essential workers are being asked to do things that others aren't. They are stepping into the line of fire to provide what we all need to stay safe. We need to do everything that we can to help them. We are not talking about robots whose lives begin and end with their essential work. These are Mississippians just like you and me. They have lives, they have homes, and many have children. Children that are now out of school for the rest of this semester. We have asked child care facilities to remain open to provide them with the ability to take care of their children. That is not easy. Today, we are providing some more guidance and more help. The Mississippi Department of Human Services and the Mississippi Department of Health are activating their Child Care Crisis Assistance in Isolation Response, or their C-CARE plan. This plan provides temporary emergency child care facilities during the crisis period for the families of essential workers, people in healthcare, first responders, and those keeping food and supplies in our homes. This is for people who do not have access to typical providers of child care. The sites will not be around forever, but they will meet all the standards of typical child care facilities. In fact, even more during these unique times. The state is working to find potential partners as we speak. They'll get free of charge training through the Early Childhood Academy, and they'll be assigned a coach to help them operate smoothly throughout this emergency. Anyone, churches, businesses, nonprofits, individuals who has the capacity to operate according to the guidelines can offer to open one of these emergency child care sites. We are asking those partners to step up now. If you are willing to become a partner, please go to mdhs.ms.gov/CCAIR, which is Child Care Crisis Assistance Isolation Response. As these sites begin to operate across the state, they will begin outreach to parents. If you need financial assistance to afford this emergency child care, you can apply for that assistance beginning 1 week from today. We hope that this expanded access to child care will lighten the load for our essential workers. It won't make their jobs easy, but we hope that it can make this one highly stressful element a little bit easier to deal with. At this time, I'm going to turn it over to Mr. Bob Anderson. I want to commend him on the job he is doing at the Department of Human Services, the stressful circumstances under which he took this job, entered this job, and how grateful we are to the work that he and his team are doing in these challenging times. Bob?
Thank you, Governor. This obviously is a new concept, but it's not a new idea. The idea is that parents who have children and who need to be at work, whether they're doctors, whether they're first responders, whether they're sanitation workers, whoever they are, if they need to be at work and they have children, they need child care. And this C-CARE idea was put together by our Division of Early Childhood Care and Development in order to come alongside existing child care providers who are still in operation. But one of the realities that we know right now is of about 1,500 child care providers across the state, somewhere around 900 of those are not operating right now. So about 60% of them are actually not in operation. And we all can understand why. They're concerned about their safety. They're concerned about the safety of those children that they care for. And they're following the governor's orders that we shelter in place to the extent that we all can. We expect parents who can do that to continue to do that, but those emergency personnel, those healthcare personnel who have to be at work, we want this C-CARE idea to make it one less thing they have to think about, that they have emergency child care opportunities available to them if their traditional child care provider is no longer operating. And as the governor's already said, Anybody can put together and stand up one of these C-Care sites. It can be a church, it can be a Y, it can be, we've talked with museums about doing this. And our role at MDHS is to simply be a partner with those who are willing to provide the care. We have a training packet that's available on the website that the governor already mentioned. And we just want to be a partner to providers who are being a resource to those parents who need this care for their children. Thank you, Governor.
Thank you, Bob, and Bob will be available for questions in just a moment. Thank you to your team for making this possible, and I know that there are going to be a large number of individuals that take advantage of it. Now, we saw 273 new cases of COVID-19 reported in our state earlier this morning. We reported, unfortunately, 11 more deaths. We are in the eye of the storm. Please, Mississippians, stay smart, stay safe, protect yourself, and protect your family. We will reopen our economy soon. We have to. It's not going to be an option. Lives are at stake due to a rapid increase in poverty as well as this public health crisis. No business is non-essential to those who rely on its paycheck for food, for supplies, and for shelter. Today, this posture is preventing imminent death. It is not forever. It is a temporary tool, and the time is coming to safely move beyond it. I hope and pray that it is very, very soon. At this time, I'd like to ask Dr. Dobbs to speak towards the where we find ourselves today with respect to COVID-19.
Very good. Thank you, Governor. As the Governor mentioned, we have 273 new cases and 11 deaths. If we look at the racial breakdown of those, 56% of the cases are African Americans and 66% of the deaths are African Americans. Again, something that we find wholly unacceptable. We've had a total of 66 outbreaks within long-term care settings. Our definition of an outbreak is a single case in an employee or a resident because we take these things so very seriously. As we talk about some of the things that Department of Health is trying to do, I do want to make sure everyone knows that we're going to target some of our testing resources into communities of greatest need. To that end, we are doing a testing location today at Mississippi Valley State in Itta-Bena, trying to identify individuals who might be infected. And then tomorrow, we have a testing set up for Lexington in Holmes County and also in Woodville in Wilkinson County. So if you live in one of these areas and you have any of the symptoms of COVID, I strongly encourage you to go to UMC's website. They have a teleportal where you can do telehealth or a phone number if you want to call and register to get tested. And this is free of charge, and they'll give you an appointment. So please, if you live in one of these areas and think that you might be infected, we want as many people as we can to come through these testing locations. If we look at sort of our preparations for the surge of hospital resources and the need for that, we continue to see relative stability in the number of COVID patients in the hospitals and in the availability of ICU beds and ventilators. If we look at yesterday's numbers, we have 149 patients and suspects with COVID-19 in intensive care. We have 275 open intensive care unit beds. As far as ventilators go, we have 100 COVID-infected patients on mechanical ventilation, which is relatively similar to yesterday's number of 99, and we have 631 available ventilators for future use. Again, as the governor said, we are kind of in the eye of the storm. It's very important for us to maintain our vigilance. I know we're all getting tired of this. It's real easy to sort of slip back, but right now is so important, and I just really want to talk to our young people out there. I've got some young people, and I know how impatient they are. And, please stay vigilant, stay at home, stay away from groups, don't socialize, because even though, and you might get sick, certainly young folks do get very sick, even though it's less likely, but you're going to bring it back to your family members, your friends, people who are vulnerable, and those folks certainly are going to be a lot more prone to have severe illness and even die. So do it not just for yourself, but do it for your family and the ones you love. Thank you, Governor.
Thank you, Dr. Dobbs, and thanks to you and your team at the Department of Health for all of your leadership during these very challenging times. Director Michelle has gone to Covington and Lawrence County. This afternoon, he'll be in Walthall County in the morning to tour additional damage. As you know, we were in Jeff Davis County and in Jones County yesterday. He and I, Senator Cindy Hyde-Smith, Congressman Guest, representatives from our federal team at FEMA and others. One of the things that Dr. Dobbs mentioned and an update that I can give you today is obviously our goal from the beginning of this has been to ensure that every single Mississippian that gets COVID-19 and can get better with quality care has access to that quality care. It has been our focus to do everything in our power to make sure that our healthcare system is not overwhelmed. We are beginning to feel more confident that we will have an adequate number of hospital beds, that we will have an adequate number of ICU beds, and that we will have an adequate number of ventilators. The challenge, as everyone has heard over the last week, is trying to ensure that we also had an adequate amount of PPE for our healthcare workers. I'm happy to tell you on Friday of this past week, we did receive almost 100,000 surgical gowns. And over the last 2 days, yesterday and today, we have received some 250,000 KN95 masks, which we are very promptly distributing out to Tier 1 facilities. And so that is a very welcome news. To say that it has been a difficult environment to ensure that we had adequate amounts of PPE is an understatement, but we are beginning to get more and more of that in, and we are beginning to feel more confident as we progress forward as it relates to that. So, again, thank you all for being here, and we'll try to answer some questions. If you have questions regarding the HHF funds, the hardest hit funds, we'll bring Scott back up in a minute, but for now, if you have questions of Mr. Anderson, we'll ask him. So we'll start over here to the left, Courtney Ann.
How quickly do you anticipate that the C-Care sites could come online? And I guess kind of a twofold question, Governor. It seemed, I know yesterday you mentioned that likely we would come out of the shelter in place and kind of steps as we entered it. It seems like if this is being put in place now that you would anticipate at least some extension as it relates to essential businesses.
Well, in terms of getting a site up and functional, we anticipate probably 8 to 10 days, maybe a little bit longer. There's some background work that needs to be done, background investigation, criminal checks, those sort of things. In fact, on the website, there's a 9-step process that lays out exactly how to become a C-Care site. And the main part of that is staff background checks, immunization checks, and going through the training that we are offering for free to anybody who wants to become a C-Care site. But we think probably about a week to 10 days, maybe a little longer, we could have a site up and running.
And how it relates to where we find ourselves in the cycle, we found that even under our executive order, which did not require shelter in place, that kept some non-essential businesses open, that some healthcare facilities, some child care facilities actually shut down. They did it for whatever reason that they chose to do it, and that certainly, as private entities, that is their prerogative. And so while I will tell you that we are having conversations every single day and 2 and 3 times many days about how quickly we can get our economy back open, we are also planning contingencies, not unlike what we planned in terms of these facilities at Shelby and community college, et cetera. We want to make sure that we have contingencies in place if things were to continue to get significantly worse than what we expect them to get. But even if they don't get significantly worse, our essential businesses are going to continue to function. Our healthcare workers are going to continue to function. And as the further along we go, there are healthcare providers, for instance, that are working every single day. They have child care facilities that, for whatever reason, some of the kids that they're used to coming are not coming now. And so we are a little bit concerned, as we are with everyone else in this new economy that we're dealing with, that some of them financially could find themselves in a difficult circumstance. And so this is just another tool in the toolbox to deal with some of these circumstances.
Would the financial assistance only apply to the C-Care facilities or for some of these that are still in operation? Does that make sense?
Yeah, if I understand your question, we currently provide financial assistance to a lot of existing child care facilities, and that will still continue to be available to those that are already operating. And then if a C-Care facility trains and stands up and becomes a C-Care trained facility, and the children that are there are entitled to financial assistance, they'll continue to get it at a C-Care facility.
What you might find is that there's a facility that exists out there, and let's just, again, we're going through supposition here, but they may have had 100 kids in their facility 6 weeks ago. Because of the effects, a number of effects, one of which is there's some non-essential workers that aren't going to work now, that facility may have gone from 100 kids in it down to 20 kids. Well, they may have found it not financially prudent for them to stay open, for instance. This may be a way in which for them to reopen so as to, if this help is provided, so that more kids get there so that it's more financially feasible for them. Ross?
And is the child care assistance, the C-Care centers, will that be free of charge to people who will utilize that service?
Well, the range of possibilities for a C-Care facility in terms of whether they charge a fee or whether they're made available for free is depending on who is sponsoring that C-Care facility. They can fund them by donations, they can fund them by charging a fee, they can fund them by taking our assistance vouchers if the children qualify for those vouchers. But they could be free. I guess the short answer is it just depends on who is providing the funding for the C-Care facility once it's put in place.
Jack from Clarion Ledger has a question. Jack?
Hey, Governor, I've got a three-part question for you about that Economic Recovery Task Force. Several of the people on that Restart Mississippi team had ties to your political campaign. Most of the executives on it were members of your campaign's finance committee. First, how were those folks selected? What exactly are they going to be doing? And then third, if they're handling public money, what oversight is there going to be?
Great, thank you. I'm going to make sure I get all three questions. My brain is not working as good now as maybe it was a few months ago before this around-the-clock, 24-hour-a-day task that we're dealing with. With respect to the individual members on the committee, they are representative of the best and the brightest minds in our business community. They are going to be making recommendations to me and to our leadership team in state government. They will not have direct ability to spend any of the federal funds that come in. They are simply going to make recommendations, and then we will make decisions based upon what we believe is in the best interest of Mississippi's citizens.
Anita Lee from Sun Herald has a question. Anita?
Hey, hello, Governor Reeves. Thank you for calling on me. I have a two-part question as well. I'm wondering when you will be making a decision on the shelter-in-place order, whether that would be extending, and specifically the moratorium on evictions that's included in that order. And when you say the economy is going to reopen soon, do you have some sort of specific timeline in mind?
Yes, my timeline is yesterday if we believed it were safe to do so. We have to open our economy as soon as it is safe to do so. We have to do it as soon as we are comfortable that our public health experts are comfortable with where we are in the cycle. Dr. Dobbs and I have had multiple conversations over the last several days regarding the measurements and the thought process of where we find ourselves today in the cycle and how quickly we can get back open. As I mentioned yesterday, we are looking at a number of different things, but for the people of Mississippi, here's the way I would explain it. If you look back over the last 4 weeks, we got into a shelter in place by taking numerous steps that ultimately got us to the shelter in place. We closed schools initially for a week. Then we closed schools for 4 weeks. Then we went into an executive order which mandated social distancing, which eliminated the ability for groups of more than 10 to get together. And then some 10 days after that, we went into a shelter in place for a 16-day period, for a little over 2 weeks. My anticipation is that over the next 3 to 4 weeks, we would see a similar approach in which we loosened the restrictions over multiple decisions so as to come out of this as we get on the other side after having flattened the curve. Again, one of the things that many people look at in terms of the data, and it's the easiest thing to look at, and that is how many new cases did we report today. That's the easiest thing to look at. But just keep in mind, that is a bit of a lagging indicator because many of those reported today were actually tested a day ago or 3 days ago, or maybe they were at a private lab and it was 3 or 4 days ago, 5 days ago, and the actual onset of their symptoms occurred a week ago or 10 days ago. And so there's a number of different things that we've got to look at as it relates to that. But we feel like at a minimum where we find ourselves today is we were at the plateau phase. We are not seeing significantly new additional cases. And then the other thing that many people look at, and the easiest thing to look at, is the daily number of deaths. But keep in mind, and this has been true everywhere in the world, and certainly we've seen it in America, in New York, the number of daily deaths is a lagging indicator. And so what I would tell you is there's no doubt in my mind that the things that we have put in place have significantly reduced the total number of cases in Mississippi and significantly reduced the likely number of deaths. With respect to your question on evictions, the elimination of the allowance of evictions has stayed in effect because it was in the shelter-in-place order. That is currently scheduled to be done on Monday, April the 20th at 8 a.m. And as we make a final decision, which we should make in the next 48 hours with respect to that shelter-in-place order, what it looks like going forward, we'll make a decision on whether those evictions will be extended as well. Adam?
It's a question for both you, Governor, and Dr. Dobbs, but I think maybe Dr. Dobbs starting might be appropriate. Y'all have both talked about this 447-page pandemic plan that existed, that I guess was finished last year. And Dr. Dobbs, I know you were on the committee that sort of helped finalize or formalize the plan as we know it today, at least. I'm wondering if you could just speak a little bit about how helpful or not helpful that plan has been generally. I know it was very heavy on Department of Health and especially emergency management too, but just wondering if you could talk a little bit about that plan.
In a lot of ways, it's extremely useful because what it is, it's a framework for developing a response. And if you read through it, you see all those ESF jargons, and all that about who does what. And so one of the most important functions is that when we stand up the State Emergency Operations Center, everybody knows their role. And they have sort of like a defined sort of operation. So like we have, mental health, we have sort of social services, we have law enforcement. So everybody kind of has a piece in there. So in that regard, it's extremely helpful. A lot of the assumptions that we had before were based on pandemic influenza, which is very different. And so that was the real challenge because a lot of our planning assumptions from that perspective, and this has to be different, is that even if you have a flu pandemic, there is a subset of people who will be mostly or partially immune. And with coronavirus, we don't have any of that, right? Everybody's, full, wide open, susceptible. And so that's a bigger challenge as far as like, if you look at the plan, the social distancing interventions were a lot softer in the plan than what we're doing, honestly. But I think that speaks to the severity and the susceptibility of the population. The other piece is we don't have some of the other tools that we have in place, especially the pharmaceutical interventions like Tamiflu and stuff like that we could use for pandemic flu. And the other one is vaccine development. Although, we're well in the early phases of vaccine development for coronavirus, we have a long way to go. But, we make flu vaccines every year, right? So we have sort of like a pathway. We get a new strain, we do this, we put it in the eggs or the media. And so those two factors are sort of like really the things that are going to make it especially difficult for us to have a comprehensive response like we would have liked to for pandemic flu.
What I would tell you from my perspective, the single most important aspect of our pandemic plan that has made the biggest difference in us being able to mitigate the height of the curve, if you will, and the total number of cases and the total number of deaths has been the fact when that group meets in the State Emergency Operations Center at MEMA's headquarters, and I call in typically, particularly the first few weeks while I was self-isolating. The most important piece of that plan that has been utilized is the fact that the State Department of Health was the lead agency in making the decisions that needed to be made. Now, obviously, as governor, I have to sign a lot of the executive orders and I have to be the ultimate decision maker, and there's no question about that. But when I look at the governor's conference room at the state EOC, Dr. Dobbs is at the head of the table. MEMA is a supporting agency. The Mississippi National Guard is a supporting agency. They've done a fantastic job doing it. Both of them have. The Mississippi Department of Transportation, the Mississippi Department of Human Services. Every agency is represented there, but everybody knows the role that they have to play. And we've had literally zero infighting about who's in charge. It is known from the beginning that the Department of Health is leading our effort. And I got to tell you, they have done a fantastic job. They have built up their team over long periods of time, and they have continued to build up their team in ensuring that as they send teams out to various communities that have potential outbreaks, that they're able to assess it, that they're able to do contact tracing, that they're able to determine who has the virus, and then ultimately either isolate or quarantine not only those who have the virus, but also those who have come in contact with those who have the virus. Follow up?
Yeah, and it, obviously, I mean, like what you were saying, Dr. Dobbs, it wasn't perfect because you couldn't have possibly planned for this exact scenario, but there were some parallels. But Governor, I wonder if there were 2 or 3 things in that plan specifically, like the closing, school closures, that the recommendations set forth in the plan clearly like didn't let you necessarily make that call. It was going to be, I think, coordination with local school officials and county health department officials. There were 2 or 3 other sort of clear moments where y'all had to deviate from that plan. I just wonder if from your perspective, if you think that it has been good, do you think it could have been better thought out or planned ahead of time? Or?
Well, what I would tell you is when you're dealing with a pandemic, and look, I'll go back to Hurricane Katrina. Y'all have heard me talk about Hurricane Katrina. I think that Mississippi was well prepared for what could have been envisioned with a major hurricane hitting the Mississippi Gulf Coast. After all, we had one in 1969, I believe. And so Mississippi had seen a major hurricane before. And so we believe that at that time Mississippi was prepared for it. But what ultimately happened when Hurricane Katrina hit is a hurricane that was 5 times larger than any natural disaster in the history of our country hit the Mississippi Gulf Coast. Well, no, we weren't prepared for that, because how you prepare for something 5 times larger than anything that you could ever fathom. And I think to a certain extent with COVID-19, many of the factors that existed out there, for instance, I don't think that when the pandemic plan that was being put in place, some 450 pages by our partners and our leaders across state government, I'm not sure that we fathom that, and it is becoming more and more clear that accurate information was not coming out of China for months and months on end. And so I think that as you try to lay out the plan, there's no way to plan for every possible scenario that exists out there. But what I will tell you is, generally speaking, the plan was very well thought out. Sure, it contemplated various things. You may recall my very first decision really was a recommendation to shut down school buildings for that first week. Now, the vast majority of school districts chose to do that. The way the statutes read in Mississippi is, for instance, local school boards have the ability to shut down their schools. I think the State Department of Education would argue that they don't have that authority under state statute. It's the reason that I had to step up and do it, because under the emergency guidelines, under my emergency declaration is what gave me the authority to shut down school buildings. Now, we did it in conjunction with the State Department of Education, working with the president of the board, the chairman of the board, and working with Dr. Wright, and we did it with conversing with numerous school districts all around the state. And so, but again, I don't, was it perfect? Of course it wasn't. It was 460 pages. I don't know if anybody could write 460 pages about any topic that was perfect, but it was well thought out, and it laid a framework and a guideline for the various steps that we've taken.
Nick from Jackson Free Press has a question. Nick?
Hi. We now have our first reported COVID-19 death in our state prisons. What steps are NSDH and MDOC taking to deter the spread of the virus in our correction system? Are inmates being given flu tests before being tested for COVID-19? And how long do those results take?
Thank you for that question. We have now had, as I appreciate it, 9 inmates tested within our correctional system. As I appreciate that, one of those 9 has now have we had a test that has returned as positive. That test did return as positive after that one inmate had passed away. My understanding is that he had significant pre-existing conditions, but the things that we are doing within our prison system to do everything in our power to avoid an outbreak in our prisons, which have been seen in many, many, many other states around the country. We were very, very early to cut off visitation to our prison system. That's a very difficult thing to do. It is for many of those that are in the system that are looking forward to getting out, having that visitation is something that's important to them. It helps from a mental health aspect, but we did do that to try to keep the virus from getting into our prison system. We also, in large part, have had our facilities under quarantine with very few, very restricted transfers. We have not allowed for visitation, and we are doing daily screening of facility staff in each of our facilities, things very similar to what we are doing here in this building, as each of you who are here came through and did temperature tests and other things such as that. We know that we have to do everything in our power to protect our inmates, and we will continue to do so. Thank you. Cordian?
We had our national investigative team, they did something on small business loans this week, and the math seems to work out that only around 5% of small businesses around the country will be able to actually access that money because of the amount that's available. How important was it for you to early on enter that for Mississippi and make that available to Mississippi?
Well, we were one of the first states to qualify for SBA loan assistance. We were one of the earlier states who received that from the federal government. But look, this is an issue in terms of the payment plan that is critical, and it's critical because the Congress put $350 billion into that program, and everybody agrees in Washington. The program passed 96-0. Republicans and Democrats alike agree that it is a good program. They allocated $350 billion for it, and everyone agrees, I believe, Republicans and Democrats alike in Washington have said that they are for the extension of the program and they're for putting more money into it. Well, they just need to do that. They need to quit playing politics. They need to quit using this crisis to try to get things that they cannot otherwise get people to vote for. And let's fund the small business program. Let's continue to allow small businesses to pay for their employees, to keep them on the payroll, because from the federal government's perspective, with what they've already passed, either we're going to help small businesses keep people on the payroll, or those individuals are going to get laid off, and the federal government's going to pay for them through unemployment compensation. It makes absolutely no sense for Speaker Pelosi to be playing politics with this, and so let's pass this. Let's get more money into that program. Let's help more small businesses. Let's get the House of Representatives to come back to Washington and actually do their job, and then we can debate all these other things that Republicans and Democrats alike want in the future. Bobby.
Speaking of that, the NGA has endorsed, I think, $500 billion for states to fill potential budget shortfalls. How do you support that? And the second part of that question, I think the CARES Act provided about $1.2 billion to the state to deal with the coronavirus.
Right.
I mean, I know we're spending a lot of money, but will we spend that much? And if not, what happens to that money?
Yeah, so that's a great question. So I'm going to take the second one first, and then I'll come back to the second one. The original package, which provided about $350 billion for the small business program that Courtney Ann mentioned, also included about $280 billion for state and local governments and hospitals. Of that $280 billion, about $150 billion of that was dedicated to state and local governments. Of that $150 billion, 13 of it went to territories and Washington, D.C. The other 137 went to state and local governments. Of that, about 55% was dedicated to states, with every state getting at least $1.25 billion. But much to the chagrin of many of the, or much to the support of many of the Democrats, and this is one of their bargaining tools, 45% of that money went to states who had cities that had more than 500,000 people in them. And so of the $137 billion that was left, 45% we were not eligible for. Now, we had a minimum amount that every state got. We got $1.2 billion. We haven't received it yet, but we should, talking to Secretary Mnuchin, be getting our money, at least a tranche of that money, before the end of April. We haven't gotten it yet. And I supported that, and I think that was the right thing to do. Now, the National Governors Association, I didn't know the number that they had asked for. I knew that they had asked for significant resources, and I am supportive of the federal government supporting states and local governmental entities for monies that are spent in response to this COVID-19 crisis. But I am more interested in individual Mississippians being supported through programs that make it easier for our economy to get back operating, get back running, so that those individuals who want to have a job can get a job and continue to provide for their families.
Just real quick.
Follow up.
I mean, will you spend that 1.2 billion? I mean, will the state spend that much on the response?
Well, yes, we will adequately use the resources that is afforded us in the federal act. We're not going to turn it down, but we're going to use it in such a way that we can grow our economy and that we can fill in the budget holes that were presented, because expenses that were not previously budgeted are eligible. And so we can't use that money to say over here, well, we spent $400 million on something that we shouldn't have because we didn't have the money available. But for things like the amount of money that we're spending for our COVID-19 response, those are the kind of things that we will utilize that money for. We'll also use that money as allowable under the statute for setting up ways in which and programs in which other local governmental entities can use it, and also for investing in our economy, investing in our people to get them back employed. In the long term, that's got to be our goal. We've lost almost 100,000 jobs in the last 3 weeks. Again, we've lost about 120 Mississippians to the COVID-19 virus. Ely and I pray for those 120 families every single day. But we've also lost 100,000 jobs. We have 100,000 people who were employed 3 weeks ago who are not currently employed in Mississippi. And by the way, that's 100,000 people that actually got through the call center or some other method, some other avenue at the Department of Employment Security. There are many others out there, and we think that number is going to go up considerably tomorrow when the unemployment claims come out tomorrow. And so we have got to recognize that this is a short-term public health crisis, the likes of which we haven't seen in over 100 years, but it's also an economic crisis. And the longer we allow this economic crisis to foster, the more trouble we are going to be in, not only as a state, but as a society. And that's something that we have got to consider as we are trying to get our economy back reopened. Ross?
I got a question for Dr. Dobbs. You talked about the testing sites at Mississippi Valley, Lexington, and Woodville to target African Americans. But you guys have known for some time that blacks are most at risk for dying from COVID-19. Why haven't you guys ramped up testing in those areas before now?
Different counties. I mean, we've been doing different Delta counties. Our first one was Coahoma, right? We've been to Adams already. So it's just a matter, I mean, we have 4 teams that are running, and you know, we've really targeted areas where our numbers are high and where our percentages of African Americans are high. Lauderdale, that was one of the first ones we did. So it's just really a continuation of our previous effort. And then also we're looking at doing additional ones with Jackson State and Tougaloo, trying to make sure that we make it as widely available as possible. Now, these mobile sites are really just a drop in the bucket, and that's the other thing we have to remember is we really need to work, and we have worked nicely with our private partners and our community health centers, because that's really going to be where the stability is, and would encourage people in their communities to identify. We have over 120 community sites that are that have dedicated themselves to testing for COVID, and a lot of those are community health centers. And so if you go to your regular doctor, that's great. If there are resource issues, we know that our community health centers are really picking up the ball, and they've got some support from federal sources to make sure that they can meet that obligation.
And just to remind everyone, there was $150 billion in the CARES Act for states and local governments. There was $130 billion in the CARES Act for hospitals around the country. And I've talked to several administrators who say that HHS, they actually received their first payment at some point within the last couple of days. There was also a significant number of dollars, and I don't know what it is, or also off the top of my head, but in the CARES Act, there was a significant number of dollars for the FQHCs to increase and enhance testing. And so if you look on the Department of Health's website, what you find is a list of testing sites throughout the state. And I haven't looked in the last 7 or 8 days and counted them. But when I looked a week or so ago, I believe there were 9 full pages of testing sites throughout Mississippi, and there was over 180 total sites statewide. If you look at testing, this is one of the things, and we talk about this on governor's calls regularly. How many tests have you run? Y'all have heard me say it just about every time I've been up here. In the early days, and it's still true to a certain extent now, but in the early days particularly, your total number of tests, your total number of positive cases were, as much as anything else, a function of how many tests you had done. Now we're beginning to see some states widen the gap. But if you look at the tests done per capita compared to every other state, and you take out those states where the federal government has pumped tremendous resources in, like our neighbor to the west, Louisiana, the federal government has pumped tremendous resources into New York and New Jersey. And I'm not being critical. I understand why they did that. They were clearly the hot spots, and they were at a different point in their cycle. But when you take those out of the equation and you look at Mississippi, we've done approximately 40,000 tests. That's approximately 13,000 and some change per 1 million population, moving towards 14,000. That's over 2.5 times what South Korea did in terms of testing. And they were considered a model nation 3 weeks ago when we were having this conversation. So I give credit to Dr. Dobbs, to UMC, to Hattiesburg Clinic and Forest General and USM and their partnership, which is now coming online, but particularly the Department of Health and private labs. Testing is one area in this crisis that has put us, relative to other states, in a very favorable position on per capita testing. Adam?
Dr. Dobbs, are we testing post-mortem?
We can, in certain circumstances.
Are we currently? If you aren't hospitalized, if you haven't been diagnosed previously, I'm wondering if those numbers could possibly be counted in death rates.
We have done some coroner cases. It's not a large number. I don't think it would be an appreciable increase over our baseline. Certainly there might be some that go undetected. But by and large, I think our numbers are pretty solid just based on the number of requests. And certainly everybody is very keyed up about COVID diagnosis. So that is something that we've done somewhat. Yeah, thank you.
Is there, I know that some other states have started coming online with this, and as we get more cases, I know more data is being added to the site, but has there been any more discussion about potentially adding the number of recovered cases?
Yeah, we're working on that. As you can imagine, it takes a while to be recovered, right? And so we're only in this to a month. We're actually doing a case-by-case assessment, which is a lot of people. So going back and seeing what the recovery rate is. So there'll have to end up some sampling sort of calculations because we won't be able to get a hold of everybody, looking at vital records and stuff like that. So that will be a value that will be available as we go through this. But the bulk of our cases haven't been sick long enough to have recovered technically, but that's something that will be available.
Yeah, and I will tell you another thing. As you look at the data and you look at recovered cases, I would submit to you, and I'm certainly no scientist or no physician, but even if you listed the number of recovered cases, you would be wrong, and you would be way wrong, because there are an awful lot of people who had the virus who never really were symptomatic. And so where we are right now is in a position in which we've had 3,000 and some change test positive. Unfortunately, we've had approximately 120 deaths, and I think we have about 100 people that are currently on ICUs. And so in our state, virtually like every other state, even the vast majority of people who test positive are going to recover. Now, if you are over the age of 65, if you have pre-existing conditions, those risks are much higher. I think everyone appreciates that. But even so, even amongst those who are symptomatic enough to get tested early on, still the vast majority of individuals who get COVID-19 are not going to pass away with it.
Jack from Thorn Ledger has another question.
Sure.
Jack?
Hey, yeah, just following up on the MDOC question. I was wondering, do you know how that inmate who tested positive for coronavirus got the virus? Have other inmates or staff that he's been in contact with been tested? I mean, I know we've talked a lot about asymptomatic spread of the virus.
Yeah, I will tell you, I'll follow up and try to get you an answer on that. I don't specifically know how that particular individual received the virus. I know that that once it became known to the leadership at the Department of Corrections that he did in fact test positive for COVID-19, they have had conversations with the State Department of Health. They did work to ensure that everyone that had come in contact with him did have that they are staying in quarantine, et cetera. And I think that's something that we're going to continue to monitor and continue to be very, very diligent on ensuring that there is proper and adequate sanitation at the facilities, and that we are continuing to keep our inmates as safe as is possible.
Emily from AP has a question. Emily?
Hi, Governor. I wanted to ask you about the issue of restrictions on the manner of worship. Last week you brought in the minister from Natchez who had the Palm Sunday in-person service, and you said that you talked to him man to man, Christian to Christian, about the importance of social distancing. That minister backed off of having in-person Easter Sunday services. Up in Greenville, the Justice Department has gotten involved in a lawsuit against the city of Greenville because of the city's restrictions on drive-in and in-person worship services. And yesterday you publicly praised Attorney General Barr for his involvement in that. I wanted to ask you, in terms of playing politics with issues dealing with coronavirus, have you reached out to either the city leaders in Greenville or to the churches that are involved in fighting those restrictions to try to diffuse the situation the way you did in Natchez?
I have not spoken to anyone in Greenville over the last 2 days. I have been fairly busy with the tornadoes that occurred on Easter Sunday. What I will tell you is this. In Greenville, the local ordinance is in direct conflict with the state emergency declaration, with the state executive order, which lists churches as an essential entity. Now, I've been very clear. I have made phone calls, I have all but begged preachers to not have in-person services with more than 10 people in their facility. But when you look at specifically what happened in Greenville, is the actions taken by an overburdensome government actually put more people at risk than had they not taken those actions. In other words, if you have families that are sitting in an automobile with their windows up and they are listening on their car radio to a preacher who is standing at the front of that building or at the front of that parking lot, and no one gets out of their vehicle, then the individuals who are sheltering in place with their family, and those same individuals with their family are in their vehicles, they are putting no one at risk. When you take 20 police officers and you put them in that parking lot and you force these individual families to roll down their windows, and these police officers at the direction of politicians are handing them tickets, well, they're putting more people at risk than had they not done that, not in addition to the fact that the executive order specifically lists churches as a essential operation. And as I have said repeatedly, I do not believe that government has the right to shut down churches. I think they have constitutional rights to do that. Now, again, let me be clear to all of our pastors out there. Please do not have in-person church services while the shelter in place is in order. We are going to get our economy back open. We're going to get our churches back open when it is safe to do so. And it is not safe to put thousands of people into individual rooms given where we are with the virus. But local governments do not have the right to shut down outside church services, and they certainly don't have the right to put more people in harm's way just because they want to do it for whatever reason.
Just to be clear, you had time to tweet out that message to the Greenville City, but you didn't have time to call the mayor. I mean, you've said it a number of times at these press briefings at different things, that if you put 20 lawyers in a room to read a document, there's probably going to be 20 different responses to that. Why not call the mayor and say, here, this is what my executive order says, and this is how it should be implemented, instead of, turning this into politics?
Well, I did turn, I've had multiple conversations with the Mississippi Municipal League. We had over 70 mayors on the call, I believe, this morning when I was communicating with them. I don't know if that specific mayor was on the call or not, but I have made it very clear throughout this process that, and it's very clear in the executive order that I signed, that local jurisdictions have the right to go further than my executive order does. So, for instance, my initial executive order that we had shut down restaurants with the exception of if they could properly social distance, then we didn't shut them down. But, so that gave local jurisdictions that if they wanted to, they had the ability to do so. But what we also said is, and we were very clear about this, that local jurisdictions don't have the ability to issue executive orders from the local level that directly conflict, for instance, what we list as essential businesses. And so I think that's very clear. Ultimately, the courts will decide this. Obviously, Attorney General Barr and the Trump administration believe that the guidelines are very clear, and ultimately a judge, whomever is hearing it, will make that ultimate decision. But I believe that the executive order speaks for itself, and I think I've been very clear throughout this entire process.
Frank from Y'all Politics has a question. Frank?
Hey, Governor.
Hey, Frank.
Quick question, just as a piggyback to Emily's there. Do you think the state should intervene or file some sort of amicus brief in lawsuits that are being filed against the city of Greenville?
Well, that'll be a decision for the lawyers to make. I don't know that, and again, I'm not a lawyer, but I'm not sure that an amicus brief from the state of Mississippi is any more powerful than the chief legal officer of the United States of America, the Attorney General under President Trump. He made clear what the U.S. government's opinion was with respect to freedom of religion. I've made very clear publicly what my opinion is. Now, whether or not we need to put that in writing in a legal document, I'll let the lawyers decide that. But it is a pretty easy call for me. Seeing no other questions at this time, I'm going to wish a few wonderful people happy birthday. To Ainsley Rogers and Elena Holmes, and to Alex Singleton. Ainsley's turning 5, Elena's turning 15, Alex is turning 10. Happy birthday, Alexander Pounds, Alea White in Hattiesburg. Allie Rourke is turning 18. Allie is a senior at Neshoba Central High School. Happy birthday to Mariah Jones and Angelyn Lancaster. Happy birthday to Andrea Johnson. Happy birthday to a senior at the University of Southern Mississippi, Anna Gail Welch, Southern Miss to the top. Happy birthday to Asher Addison, who's turning 6. Happy birthday to Bailey Sanders. Happy birthday to Billy Grubbs. Billy, by the way, is turning 83 years young today. Happy birthday to Brandon Burridge. Happy birthday to Braxton Showles in Richland. Happy birthday to Braden Graham. Happy birthday to Brianna McGinney, who is turning 16 years old today. Happy birthday to Brody Wilkins, who is turning 18. Brody is a senior at Madison Central and is attending Holmes Community College to play baseball in the fall. Happy birthday, Kason Minor over in Meridian. Happy birthday to Caleb Bessanet, to Chloe Finnegan, to Colin Van Gorder, and happy number 4 to Connor Lowe. Connor is 4 and loves construction equipment. Connor Woodard is a green belt in karate. Keep working hard, Connor. You'll be a black belt before you know it. Happy birthday up at Lewisburg Middle School in DeSoto County. Cooper Connor. A 3rd grader at Vidalia Lower Elementary, Daniel Cater. Happy birthday to Daniel Paul Woolever, to Davisha Willis, to Deborah Jackson, to Ella Grace Kennedy, to Ezra Ladner. Happy birthday, Gabby Walters and Gavin in Oakland. Happy 73rd birthday to George Thornton, to Gloria Myers, to Grayson Lewis, who wants to be a police officer when he grows up. Happy birthday to Easton Cornelius up in New Albany in Union County. Happy birthday, Hamilton Edwards, Hannah Grace Bennett, Hannah Loper, Harley in Columbus. Happy birthday, Harper Taylor and Henry Yates. Hunter Ming loves all Ole Miss sports and misses watching college baseball games. Huntley Odom, Ian Sylvester loves his dog Happy. Everybody these days needs a dog named Happy. Happy birthday, Jake Phillips and James and Katie Lovett. Happy birthday, Jana Beard, who's attending the University of Mississippi Medical School this fall. Thank you, Jana. Happy birthday to J.J. Wyndham, who's turning 27. Cadence Brown, who is turning 7. Happy birthday, J.C. Hickman and John Luke up in South Haven. Happy birthday, John Riley Rood, Joshua in Picayune. Carlisle Madison is 17 today and loves playing soccer. Kiambry McLeod and Kelsey Darnell. Khaki Little. To Clausen Madison, who's turning 17. To Christopher Cook, whose Sweet 16 is today. To Kyle Reed Hibman and Laverne Chandler. To Lindsay Coffey and Logan Beckham, who is turning 18 and is a senior at Newton County High School. Happy 16th birthday to Madison McVeigh and Madison Shirley, and Mackenzie Harris is turning 13 today. Happy birthday, Malik Clark. Happy number 10 to a 4th grader at Scott Central Elementary, Michelle Bradford. Happy number 10 to Millie McKissick, and number 12 to Molly Parrish. Happy birthday, Nash Porter. Happy birthday to Morgan Laird, Sweet 16. Happy birthday to Natalie Griffith. Natalie, your Aunt Mallory is awesome and helping us save lives. Happy birthday to Nathan Fowler and to Paige Davis, who is a student at Mississippi School of Arts down in Brookhaven. Happy birthday, Piper Howard. Happy birthday, Ray Adele Robinson, who is, again, celebrating their Sweet 16th. Happy birthday to River in Fritchcamp and Riley Bailey. And happy number 9 to Russell Cutsforth and Scotty Bradley. Happy birthday, Skylar Expose and Skylar Long and Spencer Kirk and Sylvia Bell, who's turning 15. Happy birthday to Tabria Dillard and Tony Cooper Jr. Happy birthday to Trevante Hampton and Tyler Hallmark. Happy birthday to Tyler McLaurin, who's a senior at North Forest High School, who's going to go to Millsaps and play football in the fall. Go Majors. Glad to have you at Millsaps, Tyler. Happy birthday, Virginia Robinson and Will Drennan and Wyatt Groner. And happy birthday, Zach Cobb. And also to my good friend down in Ocean Springs, Representative Hank Zuber's dad, Barry. Happy birthday, Barry. Finally, one of my favorite things to do every day is wishing a happy birthday to one of our great servicemen and women, one of our great veterans at the Mississippi Veterans Home in Oxford. Miss Shirley Roberts is turning 88 years young today. Happy birthday, Shirley. Have a great day, and God bless. Thank you all.